To this Houston press conference right now regarding the very first swine flu death in the United States. Let's listen.
This country and this community is better prepared than ever to deal with it. That doesn't mean that an influenza epidemic is a good thing. There is a report that will be presented by Dr. David Pearce, who is a public health authority for this region. Dr. Pearce, I've seen he and others within our great medical community work through hurricane disasters. We have one of the greatest medical centers in the region. There was a report that was first released this morning about a fatality in Texas. It was released by the CDC. It was a transfer patient into this area. We have great medical facilities in this area, and so it's natural that the great medical facilities in this area will be a place where there are medical transports. With more details on the particular case and the precautions citizens should take, I want to give you Dr. David Pearce. Doctor.
Thank you, Mayor. Good morning, everyone. I would just like to remind everyone that the flu virus that we're dealing with so far has behaved like the many flu viruses. It is easily spread. Apparently, we're early on here, but it appears that it's spread human to human, and it appears to be spread just like the seasonal flu. So your usual personal hygiene habits of frequent hand washing, some social distancing. If you need to cough, cough into a tissue and throw it out. If you don't have a tissue, you can cough into the corner of your elbow, and we should keep our environments clean, washing off hand doorknobs and keyboards and such like that. So that is the single most important way for folks to protect themselves. We are very saddened this morning to follow up on the news that was released this morning by the Centers for Disease Control that there has been a death of a child here in Houston. It's important for everyone to know that while the death occurred here in Houston, this unfortunate child was not a native Houstonian. This child is a resident of Mexico who traveled to Brownsville, Texas to visit family. It was there in Brownsville where the child first became ill, was taken to a hospital on April the 13th and was admitted to the hospital in Brownsville. The patient became quite ill rather rapidly and was transferred the next day to a hospital here in Houston. And as you know, unfortunately, in spite of the best efforts, the child succumbed to the illness, and the CDC provided us laboratory confirmation, which they announced this morning that the child was in fact infected with the swine flu virus. The household contacts of that patient, and in particular those that are here in Houston, are asymptomatic. They are well, and they are being looked after from a medical standpoint by professionals, and so they're being attended to as well. So that really doesn't change the landscape here in Houston. We still know that the virus is here in the United States. We know that it is in Texas. We know that we need to take our own personal precautions. The city and county public health, as well as the state and the surrounding public health agencies, are very much on top of this with very heightened surveillance. That will mean for you that we were, as cases come up, we're going to learn about them very quickly, which is different from the seasonal flu, which we monitor, but not with the amount of vigilance that we're getting now. So I don't think anybody needs to be confused by the amount of vigilance that we're paying to this virus versus the seasonal virus.
All right, so I wanted to give you a little bit of that press conference that we have been telling you was going to happen this morning, specifically regarding the first confirmed death in the United States with swine flu. That is the public health director in Houston, David Pearce, talking more about how this child, a 23-month-old, tragically died from swine flu, but also that this child had come from Mexico in order to receive treatment in Houston. So he also said that the people he came in contact with are still well at this time, and therefore this situation, as tragic as it is, does not change the landscape, as he called it, for what they will be doing in the state of Texas regarding swine flu and the outbreak. So we will stay on top of that for you. Should the situation change, we, of course, will bring you new details. Meanwhile, the swine flu outbreak, Somali pirates, North Korea's nuclear threat, no question. President Obama has been tested his first 100 days in office. How is he handling it all? CNN's White House correspondent Suzanne Malveaux takes a look.
I think this was a mistake. I think I screwed up.
Certainly not what you'd expect from your commander-in-chief. But for President Obama, Holding himself and his administration accountable has been a hallmark of his first 100 days.
Nice, guys.
Since taking office in January, it has been on-the-job crisis management training for him and his staff. 6 of his top picks ran into trouble, 4 for not paying taxes. Historians say it was Obama's mea culpa that saved him.
He's made some pretty serious mistakes, particularly in cabinet appointments, but he was able very quickly to admit his mistakes.
Mr. Obama's approach in times of crisis reveals how he leads. He's had to balance delivering bad news while calling for calm, in confronting the economic meltdown and now the swine flu outbreak.
And this is obviously a cause for concern and requires a heightened state of alert. But it's not a cause for alarm.
President Obama got high marks for using that calm in his first international crisis. Of all things, pirates who took an American captain hostage.
I'm very proud.
He laid low until after the rescue. Some see the president's cautious approach as disconcerting.
Some in Washington are asking, is he weak? And others are asking, is he too meek?
Others question whether he's playing politics by not immediately being forthcoming.
It took us a couple of days because I like to know what I'm talking about before I speak.
How he speaks is a big part of his success, says body language expert T.J. Walker.
He strides up there, completely calm, not rushed, $1 million smile on his face, and that just makes people feel more comfortable, especially in these trying times.
Walker says the president's body language is appropriate, unlike that of his predecessor.
There was a strikingly horrific picture on Chancellor Merkel's face when President Bush came up to her, put his hands on her back, and she looked like that.
President Obama also uses subtle gestures to express his displeasure.
He doesn't have to stand up and say, Vice President Biden, don't say that. Simply by shaking his head, he's showing mild disapproval. Everything is in sync, so he knows when to touch his vice president. He knows when to shake hands of a foreign leader and when not to rub their back. He's consistently appropriate.
CNN White House correspondent Suzanne Malveaux joining us now.